A great day at the office to me is when a patient comes in after surgery and they said, "Doc, you changed my life." My name is Dr. Ourian. I'm a plastic and reconstructive surgeon here in Los Angeles, California. I specialize in cosmetic surgery of the face, breast, and body, as well as transgender surgery.
Ooh, I think I'm gonna cry.
So as a plastic and reconstructive surgeon, I have the unique opportunity to make people feel better about themselves, about their bodies. And that not only affects their physical well-being, but their mental well-being. And that's very meaningful for me. What I love about what I do is I get to work with children, adults, anywhere from newborns all the way to adults in their 90s. And it's beautiful to see the circle of life, and I get to treat patients from all walks of life. HIV is transmitted through some sort of secretion, but not through kissing, not through handshaking, and certainly not through mosquitoes.
Unfortunately, there are still stigmas surrounding the fact that you can get HIV by kissing, by sharing a drink, by touching. Even if you tell somebody that, I have a friend that's HIV positive, I know what they're going through, then, they also look at that person like, whoa, you know somebody that's positive? Okay, then you're probably just like them. You're very promiscuous. That's not the case. I mean, everybody has their own unique stories and how they got it.
There's this common misconception that if you get poked with the needle with HIV during surgery, that you can contract HIV. Nothing can be further from the truth. The risk of that is exceedingly low, maybe 1 in a million. Science has proven that there's no factual basis to these claims.
Just because you get a diagnosis of HIV positive, it doesn't mean that you're infected or that you're less than, or I just want to move past the ridicule that I heard of people from my own community.
Someone is HIV positive and is undetectable. You can safely have sex with that person. It is non-transmissible. I just want to clarify that misconception that lives in our community. So it's important for patients to know this. What that means is the virus is actually not detectable by tests, meaning it's not even found in the test. So having sex with someone that's undetectable is safe. PrEP is it's called prophylaxis. So it prevents you from potentially contracting HIV, even if you're having sex with someone who is HIV positive.
Dating somebody HIV positive is really easy. I mean, it's gonna be a tough thing to do because you have to get to know somebody. You have to take that time and that extra step in preparing when you have sexual intercourse and understanding what HIV is all about and how it's acquired and how you get it. And then with the medications that we still have today, if you're on your medications, whether you're HIV positive or HIV negative, if you're using PrEP and you're HIV negative, then you'll be fine. If you're HIV positive and undetected, that means you're untransmittable because you're using your medications and taking them on the daily. And you can have normal intercourse like anybody else, whether you use protection or not.
Being undetectable for the first time in 4 years at that point, I was like, oh my God, I can even enjoy hooking up again. Also, by that point, PrEP was a thing. Sort of people's ideas around hooking up with POS people had started to shift in a new way that it hadn't in forever.
HIV in 2021 is a very treatable virus. You can live a normal, healthy life. We have medications that can treat you, and you can have a normal, long-lasting life without any compromise of the way you're enjoying your daily life.
I want to move past the stigma that you're getting a death sentence. I've been living with HIV for over 17 years, and I'm really healthy, and I'm so glad that I've been able not only to stay on my medication, but been able to survive this pandemic without dying. you know, and so I'm just really thankful that I've made it this far. Well, today, like almost 6 years later, right? You know, I have an incredible job. I work for an organization that runs a program. It's called the Trans Youth Connect program. I work in a place where I'm totally allowed to be 100% my most authentic self.
I don't think about having HIV. It's like actually one of those chronic illnesses that I believe we're really fortunate nowadays. Comparatively, you've got something like diabetes, you're checking in on yourself constantly. That's a lot more mentally taxing. And so to just have to take a pill a day, and I know it's not just that, a lot of mental and emotional aspects to living with HIV that we have to take account of.
Sure enough, learn from me that you're gonna live a long, healthy, productive, normal life. I go about my day like any normal person. I'm raising my niece. And I also work as well as a server, as a waiter. I have my podcast, the Homo Homie podcast, which is on and thriving. We're coming up to season 3.
One way that an HIV diagnosis is going to change your life is, yes, you're going to have to see a physician and take medication, but that's the only way it's going to change your life.
If you're someone who's newly diagnosed with HIV, it'll be okay. Don't worry. You'll be fine. I know people who are freshly diagnosed, they get scared. They don't know what to do. They have so many thoughts in their heads. It could be either from suicide, what their family's gonna think, what their friends gonna think. You know, are they gonna live the next day?
Arm yourself with information. I think it's really important to know the laws in your state and to find other pause people. I wish I would have reached out to somebody and said, hey, this is what I'm going through, what's up?
To know somebody who had HIV and have them educate me on it made me so much stronger as a person and made me a lot better in not fearing what I have and know that I have it, but it doesn't have me.
We're very blessed that HIV medications, yes, they're very expensive, but it's covered by insurance. So there's no need to feel like you can't afford the medications. We're here as a community to help each other out and make sure you can get the medications that you need to treat your HIV.
I think that if you are out there suffering and you need help, reach out. There are plenty of organizations that can help you. Please reach out to someone and have them connect you with me.
So being HIV positive does not preclude you from any surgical procedure. Gender-affirming surgery is included in that. You can get the same care and the same surgery that any other person can get.
What I see many times is just that people are not willing to accept themselves right where they're at. And I see that because that was once me. And it's so crazy as I go all around the state and the country and share my story. I cannot leave out the part that I transitioned while I was in the grips of my addiction, and I can't leave out the part that I'm HIV positive. For me, it just took a little bit longer to accept myself right where I was at, and that was being a trans woman, living with HIV, but recovering from addiction.
Gender-affirming surgery is a process. It's a journey. The recommended first step is to just come in for a consultation, see your doctor. I know it can be sometimes a little bit intimidating to see a physician. We're here with open arms to help. The World Professional Association for Transgender Health, the WPATH, has really helped us develop a set of guidelines to make sure this is done safely and properly. And I want to just mention, whether you decide to have surgery, whether you don't have surgery, you're still accepted, you're still validated. If you decide you want surgery at any point, we can help you get to your goal. Whatever your goal is, we will help you get there. One of the most common misconceptions for patients who want gender-affirming surgery is that I can't afford it. And what's important for everybody to know is that in many areas of the United States, gender-affirming surgery is covered by insurance. It's not about money. We can get you health insurance, and insurance will pay for your surgery.
I think at 37 years old, this is like the most authentic you will ever get, like for me, because I actually, when I began my medical transition, I was actually caught up in the grips of my addiction. And I feel like the drugs gave me like this fake courage to just not care what anybody thought. And so I did it. And then I realized that I didn't need drugs to be my most authentic self. But that journey didn't happen overnight. It happened over time. And it was one of the most difficult things that I had ever had to go through to transition while being in active addiction, and then coming out of it and then being like, oh wait, you know, I'm still Jen, and now I just gotta work on myself and continue to live in that truth.
We're just here to help. Sit down with us, chat, share with us your fears, and we can see how we can ease those fears and answer your questions. Things that I'm most proud of is finishing my training and now being available to patients that come to me. I put in so much time in my training, and being available to patients now who come to me with their insecurities, with their secrets that they keep from people, and they open up to me in that exam room, and I'm able to help them. I think it's really meaningful to me. I always tell my patients, you are the reason why I went to medical school. They're helping me as much as I'm helping them. If I get to change someone's life, I go home at night and I feel really good that I was able to help someone and change their lives. So I thank my patients for allowing me to help them just as much as they're thanking me for helping them. It's a two-way street.